Welcome, everyone. Thank you for attending our last meeting of 2021. Our next meeting is scheduled for January 7th, which I will be sending you an invite for. And we have a few things we want to discuss today. We have, as you know, our government lobbying efforts, what we have been doing, information on Bill C2, as well as information on some upcoming changes that we're going to be doing for FIC, as well as our provincial updates. So I will pass it over to Chris to get us started.
All right. Thank you, Tricia. It's good to see everyone. Just from an overall perspective on the government relations side, I wanted to say that FIC has done a great job, particularly with Tricia and Scott and Sarah this year in getting the messages out there and heard by government. And I know, Sarah, you can even speak to it in a few minutes, but having a direct relationship and building that relationship with key ministers and staff, particularly in finance, has been very important. And we will be sitting down early in the new year to flesh out our government relations plan moving forward, looking to build those further relationships with key MPs and ministers, such as Minister of Sport Pascal Saint-Onge, the Parliamentary Secretary Adam, and former Olympian Adam Van Koeverden. So those will be, and Sarah, I know you've had interactions with Adam before, but these will be key relationships to foster, to have them be champions for the fitness industry in Canada. And that's something that we will be working very keenly on, particularly early in the new year. We're also going to be working on a pre-budget submission again. With the election in the fall, the pre-budget process will start again, and the Finance Committee will call for submissions early in the new year towards the 2022 budget. And two of the key things that will most likely be part of that pre-budget submission and that we will continue to advocate on with MPs and staff are lowering the threshold for the elements of Bill C2 and the support programs, as well as the medical exemption for Canadians to have access to fitness training across Canada. So those will be two of the main elements. Bill C2 did pass the House and the Senate as of yesterday and will receive royal assent. So those are the revised support programs on CURS and Qs. So that is a good thing. I know they're, quite frankly, not as lucrative as they were before, but they are still there and accessible. And as Sarah can expand on in a minute, we are working again to lower the threshold in direct contact with folks at finance. We are also working to get details on when that will be available for members. So I will look at that later today to see exactly when that will be available. And I know, Sarah, you're going to send an email to the finance folks as well to get that dialogue going as well. So I think that's about it from me, Tricia. And I know, Sarah, you wanted to give a bit of an update on your side as well and your interactions with finance directly.
Do you want me to do my little update now, Tricia?
Yes, that would be great.
Okay. And I do have reindeer ears on. I also am having my FIC screen, so the reindeer ears look like, I can't get you guys to see them. I don't know. We'll figure that out. Oh, kind of. See? Reindeer ears. Anyways. So I did have a call with Freeland's office last week. There has been some staffing changes there and just wanting to make sure that we keep a really strong engagement and conversation. And a few things that they did share is that, every other organization is really pushing back on the 40% also, as we can expect. So that will continue to be a really, really strong advocacy piece for us. And we also heard in terms of the medical expense, that they really appreciate how we have kind of continuously kept the conversation and the advocacy alive and not just kind of kept saying, hey, let's have meetings and where are you at with this? And here's what we're still asking. We continue to provide data, we did that national survey where you're able to provide meaningful information and bring that back to Freeland's office. So we will continue to do so because strategically it is getting us traction. And there was a positive response from their office on that. So, you know, again, some wins, still some areas that, you know, we need to kind of push and close the gap. But I believe that that we're in a much better position, and we've had some really good wins. I'll just maybe quickly go into kind of our new FIC meeting structure while I'm on anyways. So as we go into the new year, we are going to really try to, we know that everybody is working so hard to get your businesses back, and we really want to respect everyone's time and have really high quality information and presentations that we are sharing with you while keeping this engagement and collaboration that we all have. So we're going to have monthly national meetings, and then there'll be monthly provincial coalition meetings. Those will likely kind of fall then 2 weeks apart, so that bi-weekly you always have an FIC call moving between provincial and national. And within our provincial and national meetings, we all have strategic plans now, which you're going to hear more about today. And we will in fact be following through on the strategic plan, updating on each of the areas and bringing forward any changes or interesting topics or advocacy that we are doing. So again, all of the meetings will be meaningful. We'll be respecting everyone's time, and as always, they will be recorded, but we love to see people live and love to see your faces. So join us as often as you can. I know that we are time sensitive for getting Carl going, because he has a very important meeting at the top of the hour with Dr. Bonnie Henry and Adrienne Dix here in BC. Carl, congratulations, first of all, on getting that meeting. Second of all, let's get you going so we can get you off to people who are far more important than me. So over to you, Carl.
Thank you very much. I see Natalie. I'm lucky enough to see Natalie. Natalie, do you see the PowerPoint presentation? Give me a, okay, good, awesome, thank you. All right, we'll get right into it here. Let's see. All right, so just a British Columbia update. COVID case counts in British Columbia continue to climb like the rest of the country. Our hospitalizations, although we know hospitalizations and death is a lagging indicator, but hospitalizations actually yesterday went down. So our hospitalizations for the pandemic are in a reasonable place today here in British Columbia. As Sarah mentioned, I have a meeting at 11 o'clock with Dr. Henry and Minister Dix. Typically, I'm asked to be, or Sarah and I are asked to be in these meetings before a press conference, which there's a press conference today in BC at 1 o'clock. Typically, that's because there's some reasonably big news coming. And so they share with industry leaders, and we're representing fitness in British Columbia in a very strong way. So we represent those leaders in fitness in BC, and they'll give us updates on what we can expect to come. They're embargoed meetings, meaning that we can't share with anybody, sort of thing, which is kind of backwards, but I always do share what I'm legally able to share with all of you, as you know. And so I have this note later, but just please, if you are an owner and operator out of British Columbia, just be available and responsive today via email, especially, because a lot of the information I'm able to share, I'll share via email. So just be available and responsive. When I found out this call was happening, followed by a press conference, I did call Dr. Henry's office. I contacted Dr. Henry's office to get a feel for what was to come. Now, this call happened yesterday, and of course, with this new variant, things are changing quite quickly. But the feel, he always shares a feel with me. His feel is that likely British Columbia will follow Ontario's lead in reducing capacities in larger venues, and some increased requirements for vaccine passports in British Columbia. That's also what the media is indicating in British Columbia as well. However, again, this is changing quite quickly. So if there's any operational changes needed in BC when it comes to gyms, I will let you know as soon as I'm able to let you know that that's coming, so you can start considering operationalizing it. I will be sharing with public health or with Dr. Henry today if there are restrictions put in place for gyms that I will share the financial impossibilities of these restrictions for our fitness centers in BC, as well as just looking at Quebec's response, putting Quebec gyms at 50% capacity and giving 2 or 3 days notice to do that. I will share the impossibilities of operationalizing a capacity decrease in British Columbia as it comes to fitness. A lot of times, as we know, public health and the government don't consider how operationally difficult, I keep saying operationally here, how operationally difficult a change in operations of operationally difficulties are in operations of gyms. And so I will share on behalf of British Columbian Fitness, our frustration there. On top of that, we have a labor law coming in to British Columbia in January so that includes paid sick days. So we'll be responsible for paying, I believe the number is 5 or 6 sick days coming. And so Angela, a provincial lead in British Columbia, Angela has kindly donated her labor lawyer to us in January. So our group, I'm really excited for our group to be able to sit with a labor lawyer and talk about paid sick days, not just how to what the rules are and what the rules mean to us, but also some strategies around how we can make sure that this doesn't affect our bottom line as much as it possibly could. So we're excited about that coming up here in BC in January for us. Just quickly, I'm going to share our wildly important goal in British Columbia. We've spoken about this as a coalition here in BC. We're looking to increase our membership by 75 members in 2022. We believe we have some low-hanging fruit, so I believe we can hit fairly close to half of this number in the first 30 to 45 days, which is exciting. And then from there, we're really going to focus a lot of our energy on prospecting for further members. This goal of 75, doing the math, really supports the big goal nationally for us, what we're looking to hit in 2022. So we're really excited to hit that goal here with our group in British Columbia. In terms of advocacy, we're going to continue to try to build relationships with the decision makers in the local health communities. So Fraser Health, Interior Health, Northern Health, Vancouver Coastal Health. We do speak directly with the president of Fraser Health, have a good relationship with her. And that's the type of relationship we want with every local level community health provider. For example, the importance of this is astronomical. We have access to Dr. Henry, which is great, but Dr. Henry this week spoke with Fraser Health, Interior Health, Northern Health in terms of advice on what the next move should be and probably what the announcements are today. We don't really have an influence at that level here in British Columbia yet. And so that's what we're working to be able to do, is help influence them and make strong decisions to keep our staff and members healthy and safe, but also our businesses. We're going to continue to work towards grant money from the provincial government. So we continue to ask for more COVID relief, as well as flooding relief, in particular businesses, fitness businesses that have been hit hard by the flooding, Abbotsford area, Chilliwack area, and up in the interior, where a lot of supplies haven't been able to get up to support operations of fitness facilities. As well, in British Columbia, our group's established that we do believe that there's a trust issue when it comes to fitness clubs in BC. We did have a large chain shut down in British Columbia during the pandemic, and we believe that when a large chain shuts down, you can imagine they probably had about 90,000 members in British Columbia that were negatively impacted, and these are 90,000 members of gyms, just not people we're trying to get to come to the gym for the first time. And so over the next little bit, we really want to build trust in British Columbia when it comes to fitness. Some partnerships. So in terms of partnerships, we're looking for 2 major partners this year. We discussed a mental health partner, and so we're going to look in that space, as well as most recently, we've been inspired by a big influencer in our group, Sheldon, with Free Motions Fitness, and we are inspired to build a relationship with a special needs partner. And so we're going to look in both of those spaces in British Columbia to really talk about and partner with groups that maybe we aren't influencing into our fitness facilities as well as we possibly could today. We're going to do continue to do community outreach, as well as involve ourselves in job fairs and positive messaging campaigns. This again was inspired by Nathalie, who rightfully said, well, hey, yeah, we have staffing shortages and staffing crises across British Columbia, across Canada today. But what's even scarier is in the next 10 years, if people don't see fitness as a viable career, where does that put us as an industry in 10 years from now? And so we really want to involve ourselves more in job fairs and positive messaging, PR, to ensure people see fitness as a viable career option in a long career, a sustainable one. In terms of infrastructure, we'd like to secure more present and available provincial leads. We have a real strong base out here in British Columbia with Jeff, Lee, Angela, Sarah. If I'm forgetting somebody, I'm so sorry, but we want to add to that group. And I'll add some color to that in just a minute. I'm sorry I'm speaking so quickly. I just need to get off this call and get onto the next call here with Dr. Henry. We also want to add, we want to have more data. So develop a database of BC fitness businesses. If you asked us today how many BC fitness businesses there are, our answer would be, we think in and around 1,500. We want to know exactly how many fitness businesses are in BC. These are our prospects. These are our leads. This is how in British Columbia, we're going to be able to communicate with all fitness and continue to be the leader of fitness in British Columbia and the council that people go to when they need support when it comes to fitness operations and like that. Okay, so next steps, we're going to add and assign areas of focus for our provincial leads. So we'd like to add a couple of provincial leads to our group and then add and assign areas of focus so that we can start setting meetings with community health decision makers. So we're going to be doing that in the next 30 days. So we will be able to report back to you in the next meeting how these meetings have gone. We're going to research and communicate with potential partners. We'll be able to report back in a month on that. We're going to close off some low-hanging fruit memberships. So we have some strong leads, some strong relationships in BC that we feel we're maybe 1 or 2 meetings away from closing and having come on. I'm sorry, I'm using membership sales wording here, but closing some deals here out here in British Columbia we're excited about. We're going to set meetings with community health decision makers, and then we're going to launch our PR campaign for January out here in BC, which will include positive messaging around how gyms are healthy, how gyms are safe, how we do that, and come see us in the new year for your New Year's resolutions. Before I close off, are there any questions? Again, I apologize for speaking so quickly there and going through it so quickly.
Great. Thank you so much, Carl. That was a great piece that you shared with us all, and good luck on your meeting with Dr. Henry's office. Before we go on to Alberta, first I'll just check to make sure Scott is able to share, but I do want to bring up a email that I sent out earlier in the week, or I guess it was last Friday, and it was a survey that was sent by URSA, and it was a survey for fitness centers and mental health. And we're requesting that everybody take some time. It's a 10-minute survey. I'll put it in the chat here, that you take some time to complete this survey, because it does actually create a data for us, and it is broken up into countries. So we will have access, FIC will have access to Canadian data when it comes to what fitness centers ideas are around mental health and supporting mental health. So if you could kindly go ahead and fill that out, it would be much appreciated.
Trisha,
right.
I'm here, but I'm driving, so
Okay.
I'll need you to be my slide person.
Sure, no problem. I will pop that up for you.
Okay, great. And apologize everybody for not being on camera. I have equipment arriving today. It was supposed to come yesterday. We had a blizzard. They were supposed to call me with a 1-hour warning, and they didn't. So they called me to say, we're here, where are you? So I'm now driving. But that is life. That's just how it happens sometimes. So I'll try my best to emulate Carl in terms of the order and speak as succinctly and operationally as he did. He's a master with his words. Alberta, so we had a meeting with the government, specifically jobs, economy, innovation, and health on Wednesday. At the time, they said they are not looking to impose any more restrictions at this time. However, it's a fluid situation with the new variant. They stressed that they're really looking to Europe to see what the impact is, as Europe was very open and is now moving to Alberta-like restrictions, and the government feels that our restrictions are amongst some of the most intense in the Western world. There was conflicting information from the Premier saying that the Christmas time rules are being relaxed. So now if you're unvaccinated, you can go ahead and host Christmas dinner with 10 other people from as many households as you want. Same rule as those that are vaccinated. And then the same day, our chief medical officer, Dr. Hinshaw, said, this variant is no joke and you should wear 2 masks and, take precautions. So, there's definitely confusion amongst the masses in terms of the rationale behind that. The government said they wanted to align policy with what was actually happening. So nobody's following the rules. So just throw the rules out the window. In terms of fitness, again, all fitness facilities are enacting the REP program, the restrictions exemption program. And at this time, there's no indication of new restrictions coming into play. However, that may change. And we know Alberta likes to change their mind last second and copy other provinces, specifically BC. So I'll be very interested to see what happens in BC today. Okay, so that's the little preamble. In terms of our wildly important goal, we want to get to 100 members in Alberta. There is low-hanging fruit in terms of the multi-location facilities. My partner in crime, Jay Ramundo, I'm not sure if Jay's on this call, but we will be meeting and kind of splitting up the list and talking about who we will be promoting and presenting membership opportunity with FIC in Alberta. And we feel that this goal is definitely attainable. When we were just letting everybody into the meetings, we had 140 people, locations on our Facebook group and calls. So getting to 100 should be fairly doable. Trisha, what else is on that slide? I don't have it memorized.
Yeah, no, you can go on to the next advocacy slide there.
Okay, so advocacy, we continue to talk with the government about promotional messaging around the hard hit sectors. So actually, Minister Schweitzer did say that they have created a campaign telling people who have been vaccinated to support the businesses that have implemented the REP program. That campaign is on pause due to the variant, but they said it is ready to go. So that was a nice surprise, that the fact that they followed through with that. We continue to advocate for the provincial fitness tax credit, physical activity tax credit, which is working its way through the different channels, I've been told. And then with Prescription to Get Active, they are helping us promote it internally to the physician groups, as well as promoting it internally with the physician groups. And then a new development is we have been assisted by the government in applying for a community grant to help operators service people with disabilities. So this is not on my slide, it's a new development, but we're very excited about it because it fits with what we're trying to do at FIC with UFIT, the initiative out of URSA to have facilities more inclusive. The objective is to provide continuing education opportunities for fitness professionals to provide better quality service for people with disabilities. So we're very excited about that. And then in terms of partnerships, we really want to build a solid relationship with Fitness Alberta, previously called the Alberta Fitness Leadership Certification Association. So Fitness Alberta, I think they have some great people. They have the opportunity to help us with surveys, and disseminating our message. And I think that would be very strategic for us, as well as in terms of labor shortage, kind of echoing what Carl said, build strategic relationships with NATE, with Mount Royal University, with U of C, with U of A, U of L, as well as Elevated Learning Academy, to create more fitness professionals in training, because we really need to have people think that fitness is a viable career. And I think that's it. Trisha, did I miss anything?
Just the infrastructure, and then we're good.
Okay, what does infrastructure say?
So focus getting memberships from multi-unit locations, which you have mentioned, and hosting quarterly roundtables.
Oh yeah. Okay, that's a good one. So, we want to get people face to face, belly to belly, obviously following whatever the rules of the day are, but at least on a quarterly basis, have operators, let's meet, let's create triads. Let's have non-competitors, so people that maybe a spin studio and a yoga studio, for example, and a big box or whatnot. Let's share what's working, best practices, common challenges, brainstorm, just be there to help each other. I think that was one of the magical things with FIC and COVID, is it brought us together. But let's continue that going and just host roundtables so people can network, make friends, and we can all share our successes and our challenges with each other. And we'll have cake.
Yes, if anybody missed our FIC cake that Natalie had graciously hosted with our Quebec leaders, that is our upcoming goal for all of our provinces.
There might be scotch too, but we'll see.
Wonderful. Thank you, Scott, for sharing. Manitoba, do we have an update here?
Sure thing. Did you want me to share my screen?
Yes, if you could, that'd be great.
Okay. Okay. So thank you very much for having me today, and I appreciate all the work that all the other provinces are doing to kind of work together, as well as the national committee. So I want to start off by saying that in Manitoba, we've had a little bit of a different kind of a situation. I'm hearing people like Scott talk about how they have lots of people who are coming to the table in other places. Of course, my phone rings right now, sorry. And we are not having that problem at all. We are having exactly the opposite problem. People are ducking and dodging and not interested in kind of being involved at this point. So we're looking at kind of regrouping here in Manitoba and going back with a different kind of a mindset. So we haven't had a chance to meet and talk about our wildly important goal, but there is one that has been established by FIC, so we will talk about that today. As far as updates, there was a meeting that was held actually yesterday with industry leaders. So usually once every 2 weeks, we have the opportunity to sit down with industry leaders from everyone from the Chamber of Commerce to trucking, tourism, kind of all kind of heads of industry, and talk about what's going on. We also do have the Chief Medical Officer of Health that attends those meetings. So it's an opportunity for us to kind of find out what is coming, where their thoughts are, and that sort of thing. So we had a meeting yesterday, and just like we've heard from other provinces, they may have some measures that are implemented. They are not at this point determining what those are. They are saying there's nothing off the table, and stay tuned. So unfortunately, it's pretty hard to prepare for a stay tuned, but that's unfortunately exactly where we are. So nothing has been developed or set out at this point, but that's kind of where we're at with that. So our wildly important goal for this year is to increase membership to 50 and members in Manitoba for 2022. I had a quick look at our list, and we only have a couple of big gyms that are kind of represented. So lots of small gyms. Having the Manitoba Fitness Council work with the FIC on this hopefully will be really great, because we have access to a lot more facilities than the FIC currently does here in Manitoba. So I'm hoping that there will be a way for us to kind of cross over with that. So one of the cool things that we have kind of coming up is we have a fitness campaign that is actually being launched starting, I believe it is next week, where we have 50 bus benches, 50 backs of buses, and 50 bus shelters, as well as a whole bunch of social media feeds that basically say exactly this. They say, get back to what works, get back to the gym. And then there's a picture of a gym, and they can log on, and we will be promoting this as well. And basically, if people log on to the campaign, they can win 6 months of membership at whatever gym they choose. So they have to tell us what gym it is that they're getting back there. So we are offering that. So the Manitoba Fitness Council is actually going to be paying for 6 months of a membership at a gym for the winning people. So hopefully that will be an incentive to get people back. We are working on grants. Again, we're focusing on kind of a reset, probably looking at starting that up again in January, as to it's kind of late in December as everyone is kind of in a different kind of mindset, looking to reconnect with fitness clubs, studios, and restart the industry association. So not as much to share here. We are going to be meeting with Trisha and Sarah. We haven't set up a date for that yet, to kind of get back and regroup and figure out how to re-engage with some of those people here in Manitoba. We never had a very strong group. We always had kind of a core group of like 10 or less, it seemed, that were really, really involved. So it will be a little bit of a, like I said, a regroup to get us back. And that is pretty much it for Manitoba. I know that Amber and Kate are on the line. If either one of those had any additional comments, feel free to jump in.
Kate or Amber, anything you wanted to add?
Not really. Great update. It has been a bit of a struggle in Manitoba for many reasons probably, but I feel like a reset in the spring in January is probably the right way to go. And I think that the partnership with MFC is going to be really helpful, just in terms of gathering data and accessing a bigger amount of fitness industry professionals and gyms in the province. So way to go, Stephanie. Good update.
Wonderful. Thank you so much. Do we have somebody from Ontario who would like to present on behalf of Ian? I know Ian was supposed to present for Ontario today, but he got called into an interview, a media interview, so was not able to make it. All right, if there is nobody who would like to speak, I can actually share Ontario's slides here and see if I can do Ian justice. So I'll just pop up Ontario's slides. All right, so for Ontario, the widely important goal for Ontario for the upcoming year is going to be increasing membership to 100 members. And in order to do that, they are planning to reach out to prior members, leverage existing members, and do some referrals if they can do referrals by reaching out to their network, and really focus on FIC's value to pitch to news members and making sure that new members do understand what it is that FIC does and why it is important for their business, as well as why it's important to support their industry. For advocacy, engaging with the government for more recovery money, ideally one of these formats, so marketing grants, so being able to apply for marketing grants, to advocate for a marketing grant for fitness businesses to be used in communicating the benefits of health and wellness, and then training, rehiring grant to help with the cost fitness facilities face on onboarding new staff. So those are the two things that they would like to focus on a little bit more when it comes to connections with the government. Partnerships, align with the national partnerships, ChemFit Pro, CFIB. So those are partners that we currently have, but seeing ways of how we can work even closer with them on a provincial level. Develop partnerships with Ontario colleges and universities. So this could be mutually beneficial for talent in the industry, and this is something that we can actually consider nationwide doing. So focusing and seeing if we can branch together relationships with universities and colleges. And then the last one here is to develop a relationship with some level of government as seen in other provinces. So seeing as Ontario has struggled to create relationships with the government, trying ways to find how to build those relationships. And that might be done more with CFIB. And I know that Ontario is working closely with our partners at grassroots as well in order to create relationships, but being able to have that connection just as BC does, where BC has calls with governments and office bodies. So that is the goal for the upcoming year as well. And then as for infrastructure, this has to do with creating more solid provincial meetings with the use of different formats of communication. So making sure that they have newsletters, provincial calls, as well as in-person events, which they are going to try to have if permitted. So that is a little bit of an update on what the next year is going to be focused on in Ontario. Does anybody in Ontario want to give an additional update on that? No, we're okay.
I can just quickly say
Oh,
that.
yes.
Hi, Tricia. I can just quickly say that our Kingston 30-minute hit, they're down to half capacity. No other locations so far yet in Ontario, but Kingston's been the hardest hit area in all of Ontario. Well, actually all of Canada with Omicron from Queens. So that area of Kingston is all fitness is 50% capacity.
Mm-hmm. And Deanna, when did that start? Would you be able to share?
Kingston is in effect now. Yeah. Yeah. And I'll let the other provinces talk.
Okay. Thank you for that update, for sure. Wonderful. And Quebec.
Hello, everybody. Whoop, whoop. I'm trying to share the screen now. Is it working?
It sure is.
Oh, nice. So I can start here. Oh my God, this is nice. So it's presented by Ford, Build Tough, or Ram Guts and Glory. So you choose. It's big today. So the announcement, we have bad news in Quebec, but fortunately for the gym and the sport, they are not closing us. So that's a good news. And since we did not have any loose or like a lot of loose in the last months for the gyms, it's not quite changing a lot of stuff here. So we're back to 2 meters. So a month ago, they said, okay, you can go for 1 meter, but only if you do a low intensity group or a low intensity exercise. So for all the group, it was 2 meters anyway. And for all the like if you do some strength, you can go at 1 meter, but you know, a lot of gym had already spread the equipment, and so I don't think many gyms change everything around since a month. So it's 2 meters all the time. The mask is mandatory when you walk, but when you train and you are at 2 meters from other people, it's okay. You can take your mask off. 50% capacity, but this is kind of weird because you choose your capacity regarding the 2 meters approach. So let's say I have 2 meters by 2 meters. I divide my square foot by that, and then it's giving me a number, and then I cut it in half. So for a 25,000 square foot facility, you can go approximately to 575 people in. So even if you cut it by half, like you can have a lot of people in. So I think the law of being a lot intelligent and the Globe and Mail law can apply here. So I'm supposed to send an email today to all the members here just to say, hey, use your brain, use your intelligence, and make sure if somebody come in, you don't look stacked and it's not like, oh my God, what's happening here? And then 2 meters, like normal rules, and you're going to be okay. There's an increasement in the case for sure. We are at more than 3,700 yesterday. So it's really a big increasement. They cut the Christmas party by half. So we are going for instead of 20, it's 10. The passport is now mandatory if you go to church, if you go to like they applied it to more stuff, and they ask people to cut their like their not exchange but meeting people by half. So they really ask to be seeing less people. So this is what was in yesterday. Am I missing some stuff, Natalie? Maybe I don't think so, but maybe if you see something, you can just tell it right now.
I think the reality is we're bizarrely grateful that there aren't actually many changes for us. It's all the other industries that had reopened that now have, so every single office party has to be canceled. All the restaurants need to go down to 50% capacity, all those layoffs that go along with that. So really we are, I dare say, spared by what's happened, the announcement yesterday, because it doesn't change much what's happening to us, but our province isn't. And so it'll be a time, I think, for us to focus on supporting the physical and mental and social health of our province in a place that this is time for us to step up and take care of our people, because it's going to be a difficult holiday period this close to it having everything be shut down by 50%. Never mind the Habs game yesterday going to all those poor thousands of people turned away when they shut the doors an hour before the game. But, so it's a time for us to step up. It's a time for us to say that, we're here and we can take care of them. And that's the opportunity, I think, for us over the next few weeks.
Yes, and today they announced that they're gonna, like, maybe the measures for the sport are not gonna be the same, so the kids can continue to play. I tried to call the media today to ask them to come to the gym, and I wanted today to be really positive and say, hey, good to go, government. You understand that physical activity is important. You stay open for gyms. You allow people to do sports. Obviously, they say outside sport is all good, so no other measures for them. But I just wanted to do a positive pressure, saying it's a good decision and focusing on fitness and focusing on physical activity as part of the healthcare system. But I'm still waiting for news. I think they are searching people that are mad and angry. And obviously I was not. I wanted to say, hey, good job and thank you for letting the gyms running and permitting people to train. So that's it for Quebec. Like, we have been really closed a lot since a year, and we were the first to close and the last to open. So we cross our fingers just to make sure, or just to wish they are not going to change their mind. But for now, it's this. For the widely important goal, the wig, I need a wig. Here I need one, but for the FIC wig, we try to increase our membership from 140 plus, a little bit more than 140 to 225, and I will explain further how we do it. So for the advocacy, we're going to engage with government, of course, for the fitness tax credit here. Also, physical activity equals health. So asking the government to do publicity. They started a little bit. I saw a lot of, not a lot, but a few advertisements saying, hey, you have to move. But it was not as important as they do it for, I don't know, don't drink and drive, or watch out for injuries on your workplace, or ecology, or that kind of stuff. And we ask government to bring the money in the publicity as equal as you do for other kind of problems, society problems, and they have an impact on health. Also, our professionals should be recognized as health workers. Like, if you go to the physiotherapist, if you go to the chiro practitioner, or even having a massage, even if you don't have a passport, you can go to those places. But if you're post-surgery and you need to go in a gym to train, to re-educate your shoulder or your hips or whatever, you cannot go to a gym if you don't have the passport, the vaccine passport. So we just ask for the professional, like kinesiologists and other professional, to be recognized as healthcare workers, let's say it that way. Also, physical activity incentive shouldn't be taxable. So if a company invests in bringing a coach in or spinning classes or whatever, it's a taxable expense for the employee. So we would like government to take that away and making sure it's helping business to help people and help employee move more. So this is another thing we're going to work on. Engaging with city for sure. I've been involved in municipal politics recently, and I will have a meeting with Quebec City on the beginning of January to organize and maybe this could be an idea for all of you guys. We always seek the attention of provincial, but we can work with cities, and if a city change their way and change the way they help businesses invest in physical activity, they help the gym, they help a city can do advertisement. We don't have to wait on government, provincial government. We can ask the city of Quebec, let's say here, to do some publicity like a journal and TV and all those stuff, radio, and they have budget for that. So I'm going to try to work hard with Quebec City in January to bring all those ideas up. Create some stickers for all the gyms to have be proud of member of FIC, and making sure our members are recognizable, and also that the population start to heard of us more often. Partnership, I'm already talking with CrossFit Canada to bring, they have more than 300 gyms in Canada, but it's another kind of, it's not a franchise, it's another structure, but for sure it would help, I think, the FIC to have all the CrossFit joining. So we are working with CrossFit right now. The path map and Actiz, this is really provincial incentive. The government is having like money to help businesses increase their what they give to employee to motivate them to work like workout. And so you have I think it's a 50,000 grant for creating a gym, bringing a coach, offering some physical activity incentive to your employee. So we're going to work with them to show them the gym can be part of the solution. So instead of all the company investing in a gym inside their company, we should go, and like gyms are made for those people. So come here and government pay the membership, and we're going to help people move more. And we have something special here. Expertise 360 it's a French web platform for education regarding physical activity, sport, and everything. And all the members are going to receive a monthly conference. It's going to be free for them, with a lot of professional in the fitness industry. So if you're a member in Quebec, you're going to have access to that also. Getting more FIC members, for sure, it's a goal. Today I'm going to send a little bit more than 1,200, I think, email, but all the gyms, and I have a list with it's MailChimp, and all the fitness companies in Quebec. So 630 gyms and a lot of other professionals are going to receive a survey regarding the industry. So just wanted to know, like, how is your business doing? What do you see as a problem, and blah, blah, blah. So it's, I think, 15 questions. It's 7 minutes, but it's a good way to, even if you're not a member, like, fill the survey, give us some information so we can lobby for all the industry, and we have the right answer. And then in that same email, I present to them what we did in 2021 in the federal aspect, in a provincial also aspect, and then I invite them to join FIC. So this is going to be sent today. And if they want to enter the information letter, we're going to send each and every month with the new way FIC is doing. And the next step is today sending the email and like starting to have some answers and just connect with them, having the resume of what I've been done and what is up to come and what we are fighting for in 2022. and asking them to come and join the fight or join the actions we are going to take. So that's it.
Awesome. Thank you so much for sharing.
Stop sharing. How do I do that?
Oh, here, let me stop for you.
Oh,
You got it?
good.
Okay. Perfect. Thank you, Gabriel, for such a great update. And also putting us on a great positive momentum, as well as giving us some insight on what you're going to get started with, what the Quebec team is doing, and how you have really rallied together in Quebec as well to gather FIC members and continue to do so. So that's really wonderful to hear and share. Thank you for that.
Thank you.
So we have a couple minutes left. Do we have any comments, questions that we'd like to go over before we end our call for this year? Any final words anybody would like to say?
Thank you, Tricia, for keeping us entertained and collaborative and on point all year round. You deserve a little bit of a holiday, my friend. Thanks for everything, Tricia. Congratulations,
for everything,
Sarah, and
Tricia.
everybody on the
Thank
team.
you.
Everyone have a holiday season, and we'll see everyone in the new year. Look for that first national meeting, and we'll be seeing you guys every month. 2022, we just have to believe this is going to be a great year. So we're going to believe. Okay, thanks everyone.
Take care, everyone.